respirate. The baby is not able to do a respiration. If the baby is inside the mother's womb, it won't go for the respiration. The needed oxygen is given to the baby from mother's umbilical cord. It will come through the placenta. Through which artery? Umbilical artery and umbilical vein. The oxygen of the transport of the oxygen will be there. If the baby is not crying after the postpartum, after the delivery, the baby won't receive any oxygen. So the baby will go for bluish in color. It is called as blue baby syndrome. So this is a natal cause. In the postnatal cause, after the baby is being birthed, after this baby is coming out from the mother's womb, it may get any infection. It may undergo any trauma, like any direct hit. It may be go under any infections like meningitis. The meninges will go for inflammation in there. Like that, it will cause CP. This is coming under postnatal cause. Then, what may be the pathology behind this? First one is the atrophy. The atrophy of the, what is meant by atrophy? The brain cells won't work. Brain cells, we are not using our brain cells. Most of you are not using your brain cells yet? No, we are using the brain cells. After that, the brain cells are not being used. So it goes for the atrophy. It is main pathology here. Second one is the degeneration of the basal ganglia because of any of these causes. Degeneration of the basal ganglia. What is the main use of the basal ganglia? Balance and coordination. Mainly the motor and cognition, it is the part of the basal ganglia. If the basal ganglia is not working, then it will lead to cerebral palsy. It is the pathology. I already said there is no progressive pathology, but there is a pathology behind every condition. Gliosis. You may hear of a cell named glial cells. The cell which is responsible for, the cell which is helping other cells, like you all. Cells which are helping the brain cells, the neurons, are called as the glial cells. If the glial cells, what are the glial cells you know? Astrocytes, oligodendrocytes. These are some of the glial cells which is helping the brain cells, the neurons. Neurons are the brain cells, yes, no. It is the basic structural and functional unit of the brain. It will help the brain cells. If these cells goes for any degeneration, it will lead to the cerebral palsy. Okay. The pathology is clear. Then we are coming for the types. There are two types of types. The one type is coming under this one. The another type is this one. This type is based on the which part of the brain is being involved or which part is involved. So what are the signs and the symptoms are going to happen in the child. So that is because of the signs and symptoms. The first name is called spastic CP. The spastic name itself says the child will go for spasticity. What is meant by spasticity? Increase in the muscle tone. The muscle tone will get increased so that the babies go for spastic in nature. All the muscles in the flexor or in the extensor compartment will go for the spastic in nature. Second one is the ataxic or the attitude. The most common condition which affects the baby is the CP. In that, the most common type is the spastic CP, which we saw. In that spastic CP, the baby is unable to walk, the baby is unable to swallow, the baby is unable to speak. These are the main symptoms which comes to the spastic CP child. Then we go for attitude. In the attitude, the IQ will be normal. The IQ will be good. But in this attitude, the baby can't able to do its own movement. In this spasticity, the baby goes for spastic, which means It is higher than our normal muscle value. It is higher than our required muscle value, so it goes for very contracture state. It is the spasticity. In this attitude, the baby goes for very flaccid. Flaccid means, what's meant by flaccid here? Decrease in the muscle tone. He or she, the baby cannot be able to move his or her limb. It is coming under the attitude state. In this, the seizure and chorea are very common. What's meant by seizure? I already mentioned that. The seizure is involuntary brain action, involuntary brain movement. It will give some other stimulus to the part which is included, which it is controlled by that part. Seizures, valipur, kaka valipur. Hear this. It's an abnormal movement.